Hi guys, welcome back to my channel. Thank you all for your likes, your shares, and your subscriptions. Welcome back. Today we're talking about a long-awaited video, I think, on the difference between working in a nursing home and in a hospital. So let me just say this before I go any further, that I've worked in a hospital ever since I've been qualified, really. So most of what I'll share on nursing homes is what I've heard, um, because I don't have that much experience in with nursing homes, really. But then, yeah, I'll still share what I've researched so that it helps one or two people make a decision maybe on where they'll want to work once they relocate to the Republic of Ireland. So yeah, maybe let me start with the nursing home first and just give you the general outlay of a nursing home before I talk about the hospital. So basically, a nursing home is where old people live. This is their home. This is where sometimes they are kept, maybe as they progress into the last days of their lives. So it's an environment, from my attachments that I did when I was a student nurse, it's an environment basically that is like a home that is meant to be very comfortable for them till they leave this earth, or till they get to the last stages of their life. So yeah, so basically these older people are known as residents. So they most of them would have maybe dementia, Alzheimer's, or chronic conditions like hypertension, diabetes mellitus. So basically it's a place or a nursing home for residents who've got chronic conditions, right? And then uh, I the duties performed there are basically the same as a hospital in terms of drug administration, in terms of ordering medications, um, but then it's to a larger number of patients compared to the hospital. So I'll get into the nurse patient ratio when I'm not of the hospital, when I'm not talking about the hospital. But the nurse patient ratio for a nursing home is generally large. This is because most of the patients are stable. But then I think the only tricky part with this is when you get your handover, you should be able to pinpoint who needs your attention first out of the 30, because obviously you will have some that are stable, and then maybe one that's just gotten ill. So you need to sort of figure out who needs your attention first, so that you pay attention to that one before you go to the stable ones. And then also, like I was saying, the nursing home, the duties are the same. You still do drug administration, you still do dressings, you still order medications, but there are resources that are not easily accessible. For example, you don't have that much support in terms of other healthcare staff. You don't have doctors around you all the time. Medical doctors are not available in the nursing home the same way you'd find them in a hospital. So it means once you see that a patient is deteriorating, then you have to make sure that you are calling the GP or whoever, the doctor, to come and see the relevant doctor to come and see that patient before they deteriorate further. And then the other challenge with that I find is that if that patient needs resuscitation, it means it's you and probably the people who are there on that shift who need to start that while you wait either for an ambulance or for help. So basically, I feel like a nursing home puts you on the spot sometimes, but also remember that this is not going to be all the time that you're going to have to do resuscitation. But it means if you're going to choose to go work there, you need to be knowing your resuscitation skills very well, because you're the first port of call. You're the one who starts it before anyone else arrives, right? And then yeah, so I think as compared to the hospital, it's a more relaxed environment. Like we said, this is a home, it's a home for residents, older people who are living with chronic conditions, but we're trying to make it very comfortable for them. So it's a relaxed environment. They're probably in the lounge or in a certain room doing certain activities on certain days. Obviously activities are done for them just to enjoy, for them to feel like they're living their life, still living their lives, although it's in a confined environment. And then other than that, referring patients, so you find that in the hospital you have those multidisciplinary team members easily accessible, whereas in the nursing home, if you feel like a patient needs physio, if you feel like a patient needs this, you have to refer the patient to the relevant whether it's the physiotherapist or whoever you feel they need to be seen by. And then reviewing care plans and risk assessments for patients. So remember, these are elderly patients. They're at risk of falls. They're at risk of a lot of other things, maybe pressure sores. So there's a regular or review of their risk assessments and their care plans to see how they should be cared for and what they're at risk for and how that can be avoided. So that's also your job. And then also, I think in a nursing home, you form attachments, because these are people who are there for a long period of time. So you are going to end up forming attachments with them, maybe, and their family members. This works out okay in the fact that you know their likes and their dislikes, and you're able to care for them better. But also, if you're maybe a very emotional person, or even if you're not, it will affect you once you form a bond with someone. If they pass on, or if they deteriorate, it definitely affects you as their caregiver. So basically, I think for a nursing home, that's what it entails: a larger nurse-patient ratio, but with a lot more stable patients. You don't have as much resources around you. You are the port of call for everything. You have to determine the patient's condition and what step to take next, whether you need to call the GP, whether you need to call the ambulance immediately, whether you need to start resuscitation. You need to perform risk assessments and care assessments of the patients and see what the patient is at risk of or what care they need for that. And yeah, other than that, we all know in nursing, anything that is not documented is not done. So you make sure that your documentation is done, and for anything that you do for the patients in the home. And then things like shift report, you hand over what you've done for your shift to the next shift, are the same as the hospital. So yeah, all in all, that's basically it on the nursing home. And then we move on to the hospital setup. So now this is where I know what I'm talking about. So basically, the hospital is an acute place. When I say it's an acute place, I mean the patients can be acutely ill. Their condition can change anytime. They can either deteriorate or improve. But also, they don't stay very long. It's either they come, it's like there's a lot of what can I say? A lot of traffic in the hospital, because they come in and go, they come and go. It's like they're very sick 1 minute, they come in, they get help, they're fine, they go, the next one comes in. That's how busy it is. They don't stay for as long as people stay for in a residential home, or in a nursing home. So the nurse patient ratio, from what I've seen ever since I've come to Ireland, it depends on how big your hospital is and how large of what can I say, of a territory is covering, or how many people it's going to be basically how many people go to that hospital. So if it's in a small place, you're probably going to be seeing less patients. But I'll give an example of where I work. I would say mine is a medium-sized hospital compared to, let's say, Mpido Central Hospital, where I was working. It's way smaller. Everything is within, I would say maybe everything would be within the main hospital, which would be the peds. Peds would be there, the maternity would be there. So we don't have like different, the maternity separately, peds separately, the main hospital separately. Everything is in one. So I would say it's small. It's a medium-sized hospital, but then we do have a lot of traffic, because sometimes people come to us from other counties when their hospitals are too busy. In as much as we have lots of traffic, though, ever since the busiest I've had, I think maybe 6 patients, 5-6 patients. So I think I would roughly say maybe in a hospital you would have roughly 6 patients. Maybe it could go up to 10, depending on like how big your hospital is. But then you have less patients because they are likely to change conditions anytime. They could either get better or deteriorate, like I explained before. So other than that, the duties are basically the same. You're administering medications, you're taking bloods, you're ordering drugs. For some hospitals, if it's during the week, you have the pharmacist coming to make sure that the drugs are available. But if it's the weekend, you need to order your own drugs. You're doing dressings, you're liaising. So you communicate in the hospital. It's different in the sense that there's a lot more. There are charge nurses, there are fellow nurses, there are doctors, there are dietitians, physiotherapists, everyone is available. So it's a matter of making a call or writing, sending a referral if you want your patient to be seen, and that is done within the day. It's not something that will be done today, then the patient is seen tomorrow or 2 days later. It's a matter of minutes where you just phone and ask, oh, we need this, or we need the diabetic nurse to come and see. We have a newly diagnosed DM patient. That it's that kind of setup where everyone is readily available. So it's a multidisciplinary team that's readily available to take care of the patients in the hospital. And then also in the hospital, it depends now. Like for me, I work in the peds. Our peds is an emergency department, so sometimes you triage patients, sometimes you triage patients, you get them seen, doing things like ECGs. If they've got a chest pain or something, you make sure you get it, you do an ECG. You have to be able to read it and tell whether it's normal or not. And yeah, then sometimes we take care of oncology patients as well. We're doing blood transfusions, we're doing their bloods, what else, yeah, platelet transfusions. And yeah, other than that, yeah, we take care of basically medical, surgical, oncology patients. We see a whole lot of things in the hospital, I should say. And then the shifts, from what I've heard, they are more or less the same with the nursing home, 12 hours per shift. With the hospital, sometimes you'll do maybe half a shift, half a normal shift, or 4 hours or 4 to 6 hours, just for your hours to total up, because there are a certain number of hours you're supposed to work a week. And then other than that, we do document everything. Like I said before, anything not documented in nursing is not done. So you make sure everything you've done for the patient is documented, and then you hand over your patient's condition. When your shift is over, you tell the following shift your page basically about your patient, the history and all, and the treatment so far, and what needs to be done. And then I would say in a hospital, yes, we do for us with kids, obviously, for them to get you to do anything on them, you need to form a little bit of a relationship with them. But we don't really form attachments because they don't stay so long. They're in a day or 2 or 3 days and they're gone. It's very few of them that will actually stay for long. And then overally, I would say in a hospital you come across a lot of conditions. There's a lot to learn. You're exposed to a whole lot more. You interact with a whole lot more people. So it all depends on you, whether you want to be in a setup that's a little more relaxed, like a nursing home, where it's pretty straightforward, but at the same time, when things happen, when you need to resuscitate, you should be competent enough to do it. Whereas if you're in a hospital setup, if we need to have a resuscitation, we basically have the whole team, where we're saying, you know how the resuscitation team goes, where we know we have whoever is the lead, and then we've got the doctors there, we've got someone, the timekeeper, we've got someone doing the drugs, because there's a lot of staff around. And then other than that, you have lots of support in terms of staff in the hospital. You have people to ask, you've got senior nurses, you've got people to help you, you can delegate to even the junior nurses. You don't have, like, you do have a workload, but then you can, if you're not sure about certain things, you've got people really to ask. You can go to the charge nurse, you can go to your senior nurses, you can get, you've got a whole team with you. And a lot of things, sometimes you're not all, it's not all on you. It's like maybe a newly diagnosed diabetic patient, you know that the dietitian is going to come in and do their jobs in terms of dietary counseling, in terms of wounds. You've got the TVNs, the tissue viability nurses. There's a whole lot of support in the hospital setup. So basically that's what I can say. It's all up to you. It's all, for me, I love the hospital because you learn a lot. Honestly, you see a lot in the hospital. With the nursing home, I feel it's the same thing, and that continuous cycle. But then also, you have the information. It's all up to you to decide what suits you. You don't do what I like or what another person likes. You do what suits yourself. So I hope it helps someone. That's the nursing home versus the hospital. Thank you guys. Please like, please share, please subscribe.